So, about 20% of women will experience a peripartum mood disorder, which could include depression, anxiety, post traumatic stress disorder, psychosis. And so, we really want to be proactive and letting women know at their prenatal visit that this is a possibility. But Black women are more likely to experience those symptoms, up to maybe 40%, but unfortunately are less likely to be treated. And you might wonder, well, why is that? It could be lack of access. It could be because of stigma when seeking mental health services. But I think what you have to take into account, Black women are going to be more likely to suffer mental health disorders just because of the legacy of health disparities in this country. Some Black women are very fearful of the healthcare system, as you can imagine, due to the public health crisis of Black maternal mortality. So we're asking them to rebuild trust in us, but the statistics are actually stacked against us. So we have to encourage women to not only seek physical health care, but also know that behavioral health care treatments, whether that's therapy or medicines or both, is still valid and worthwhile.
But culturally, those stigmas, I think, are a lot more alive and dominant in ethnic communities. I mean, I know that there's a stigma in general, but I think within the minority populations, it's even worse. Of nobody's ever known anybody who went to therapy, so there's definitely like a fear of the unknown. Nobody talks about it if they do. So it's definitely still a very taboo subject. But what would a woman?
Absolutely.
Go ahead.
Well, I'm just going to say, like, it is very much familiar in my culture. If someone's suffering from a mental health disorder, they'll say, well, just pray through it. And I think on one hand, that is a good thing in that it respects the fact that Black people have always used our faith houses for community support, right? I mean, you think about how the role that the church played in Martin Luther King and the Montgomery bus boycott, for example. So I like that faith is the center when we're talking about psychological issues in our community. But I also think that the God that I serve gives us resources. You can pray through your problems and you can seek mental health services, right? I think there's no reason why you can't have a counselor and go to church. I happen to be a member of Wheeler Avenue Baptist Church here in Houston, and I listened to our prayer call this morning with Pastor Marcus D. Cosby, and he said, I'm praying for any of you on this call who are suffering with depression and anxiety. And I love that because here is a respected minister saying, I know what you're going through, but so does the Bible. So it gives people hope. And I think that's exactly what we're looking for. That's the purpose of this week. We know that systemic racism and implicit bias is very much so contributing to Black maternal mortality. But I also want Black women to know that we can redefine ourselves. We can take those challenges and overcome them as we always have. So we don't have to suffer in silence when it comes to our behavioral health.
Mhm. So often, though, when we turn to somebody in our trusted community, a lot of pregnancy and postpartum issues are dismissed as, oh, that's totally normal, it's baby blues, things like that. What would some symptoms be like that somebody would know that it's a little bit more than normal hormonal changes, that they would actually need more help?
It's such a good question. I would tell patients if you are experiencing crying spells, if you're feeling so anxious that you're unable to sleep, you're watching your baby breathe because you fear that they will not, if you're not able to eat, if you don't enjoy the things that brought you happiness before pregnancy, those are the signs that it's not necessarily just postpartum blues, which generally affects people the first 2 weeks after birth. And sometimes a woman may never have the insight to know that she's experienced those things. It might take her family members or her friends or even her healthcare provider to know those things. And it's not just obstetrician and gynecologists who we invite to kind of screen for postpartum depression and anxiety. Sometimes pediatricians will alert us, I was evaluating the baby and I noticed that the mom wasn't making good eye contact. She didn't seem to be bonding well with baby. So it really takes all of us as a community to try to support that mom and know that this is not her fault. Most postpartum mood changes can be attributed to hormonal changes, lack of sleep, and the overall overwhelming kind of feeling of having to take care of a newborn. But we want her to know that we can help her get through it.
And one of the statistics that I read said that the postpartum period, a lot of the mental health struggles, like the most extreme cases of suicide or substance abuse, that actually happens closer to a year out than immediately after birth. You've seen that those same statistics before?
Absolutely. And I think we are not doing a good service for our patients if we're telling them that one time 6 week postpartum visit is all that you need to verify that you can return to usual activities. I definitely consider the postpartum period up to a year. Consider it like an adjustment disorder. You are getting used to your new role as mother, and you're getting used to this new member of the family. Doesn't matter if it's your 10th child or your first, there's a change in the dynamic. So you have to be able to accommodate those things. And I definitely always am telling my patients, some people are not diagnosed with their postpartum depression or anxiety until 6 months after birth. Who's evaluating those patients? At my place of work, Bell Obstetrics and Gynecology, I tried to change that narrative by adding a 2 week postpartum visit, even if it's virtual for patients. We commonly do see them at the 6 week mark, but then we also invite them back 4 months after birth for a well woman exam. Regardless of the time of year you normally would have a well woman exam, we want to make sure we're having face to face contact with those moms so that they know this is a safe environment to speak up and say, I'm not okay. And it's our opportunity to connect them to counselors or therapists or psychiatrists. So we don't want people suffering in silence at home alone with their newborn. We want them to stay in someone's care.
Yeah, very good. Do you happen to know if insurance will cover them coming in more frequently or Medicare? Because I know that that's a big issue with we just can't get the coverage to see our doctor that much more than just the 1 6 week appointment.
Fair. And so it kind of depends on the practice type and the style, and of course, the medical insurance. But I think what people should not be alarmed by, or they should not see it as a deterrent, if someone has a postpartum mood disorder, now that is the code and that is the diagnosis we are using for those more frequent visits. So it's not considered routine postpartum care. So if someone was identified at the 2 week mark as not sleeping well, as not eating, as not being able to bond with their baby, now that person's going to require more interventions. And so that is what's going to allow insurance coverage.
That's what we need too, as doctors to think it through like that so that we can get the care that we need. Dr. Sillas, you are always really wonderful with this topic. Thank you so much.
Thank you for having me.
Yeah, I don't have any other questions unless there's something else that you'd like to add.
Just say, when we think about the legacy of Black women interacting with the healthcare system in the United States, there has definitely been some atrocities. And I think that has to be accounted for. I think of Fannie Lou Hamer, who is a celebrated Mississippi politician who went to surgery for removal of a uterine tumor and woke up with a hysterectomy. She said that uteri of Black women were removed so commonly because it was the general thought that Black women didn't need to procreate that she coined the term Mississippi appendectomy. So many women were getting their fallopian tubes damaged or removed without their consent in our community. People in my community that look like me remember the Tuskegee study for syphilis of the Negro male, where the government was aware that penicillin could cure it, but it was allowed to ensue. Those things are not lost. If anything, they're passed on as traumas, where your grandparents might say, oh no, don't go to the doctor, they won't help you. We really, as a healthcare community, have to acknowledge those atrocities have occurred, that healthcare disparities exist, so that we can build confidence again. I don't ever want a Black woman in a birthing experience to feel like I am not doing well, I am not coping with this is overwhelming, and she not seek care. So I want everyone that is listening to know there is hope and we can overcome this. And it will take all of us in the healthcare community to prepare you for those postpartum mood changes and to offer you solutions.